Good afternoon, everyone. I'm calling to order the Assembly Health Committee meeting of June 9th. We only have one item on our agenda today, SB 277. I want to thank Senators Pan and Allen for bringing this important measure forward. I look forward to a robust discussion today. I want to make a couple quick points on our process. Given the heightened interest in this bill and to ensure a robust debate today, I'm allowing additional testimony beyond our normal committee rules. We will allow 25 minutes for expert witnesses on each side. After we hear from witnesses on each side, we will allow time for members to ask questions while the expert testimony is fresh in their minds. And after members have asked questions directly of authors and witnesses, we will open the microphones for public testimony. All additional witnesses after the expert witnesses speak are to state only their name, organization, or city, and their position. And I'm going to need to hold everyone to that because we have a lot of speakers who want to speak today, and in order to let everybody speak, we must commit to the same rules for everybody. Name, organization, or city, and position. The sergeants will be directing members of the public who wish to speak to the nearest microphone. We'll have microphones both down here on the floor as well as in the gallery above. And the process we're going to be following is first having everyone speak from the floor. And once you speak, you'll be asked to leave the room to make space for others who want to speak. And that space will be filled behind you. And after we finish on the floor, we'll go up to the top to the gallery and then back down to the floor and proceed in that fashion until everyone has had an opportunity to speak. We're at capacity, and we don't want to have any problems with the fire marshal. So in order to make sure that everyone has a chance to be heard, we need to follow those rules. I want to thank in advance everyone for being here today. I know a lot of you have traveled a long way, which I appreciate. So we're going to get started. Senators Pan and Allen, you may open. And as you're coming up, I'm going to take roll. We have a quorum. Madam Secretary, please call the roll.
Bonta?
Here.
Bonta here. Mainshine? Here. Bonilla? Burke? Chavez?
Here.
Chu?
Here.
Gomez? Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Santiago? Steinnorth?
Here.
Thurmond? Waldron? Wood?
We have 11 present. We have a quorum. Dr. Pan, whenever you're ready.
Thank you. Thank you, Chairman Bonta and members. It's a pleasure to be back here in this room again and to see you again. Senator Allen and I are pleased to present SB 277. SB 277 is a bill that protects children and the public from preventable contagions by abolishing the personal belief exemption to legally required vaccinations for enrollment in school. I want to thank the chair and committee staff for your hard work on the bill, and we are accepting the proposed committee amendments as described in the analysis. Thank you. SB 277 is about freedom. Freedom from deadly, crippling contagions.
All right, wait a second. We have a business meeting here to conduct, and that means we're not going to have any comments, laughter, other comments from the audience. We're going to let our presenter present, and then everyone else is going to have a chance to speak. If we don't follow those rules, we're going to have a problem today. So please, no comments, no laughter, no clapping, no booing, no cheering. Listening, please, and when it's your opportunity to speak, you will. Thank you.
Thank you. And I'm disappointed that there's some people who don't believe in freedom here, but SB 277 is about freedom, freedom from deadly, crippling contagions that are now preventable through the science of vaccination. Vaccines are one of the greatest health achievements of mankind. The Centers for Disease Control list immunizations as one of the 10 great public health achievements that resulted in adding 25 years of life expectancy for Americans. The World Health Organization describes vaccination as second only to clean water in reducing the burden of infectious disease. Vaccinations have prevented more than 21 million hospitalizations and 732,000 deaths among children born in the last 20 years. Vaccines are safe, and vaccines work. The Institute of Medicine, which is part of the National Academy of Sciences, examined the research and data on vaccine safety and concluded that, quote, there's no evidence of major safety concerns associated with adherence to the childhood immunization schedule, unquote. The Cochrane Collaboration, a global independent network of health experts that analyzes research for evidence-based medicine, examined 5 randomized controlled trials, 1 controlled clinical trial, 27 cohort studies, 17 case control studies, 5 time series trials, 1 case crossover trial, 2 ecological studies, 6 self-controlled case series studies involving in all about 14,700,000 children, assessing the efficacy and safety of the MMR vaccine, and showed that there was no scientific evidence to suggest that the MMR is associated with autism, asthma, leukemia, hay fever, type 1 diabetes, gait disturbance, Crohn's disease, the myelinating disease, or bacterial or viral infections. These findings are also supported by the World Health Organization, the European Union, the Centers for Disease Control, the American Medical Association, and other leading medical, scientific, and public health organizations in the United States and across the world. Evidence shows that the disease being prevented is at least 1,000 times more likely to cause lasting problems than the vaccine itself. And there have been no confirmed deaths caused by the measles vaccine, nor any confirmed death cases of that vaccine infecting another person. Our country takes vaccine safety very seriously, and extraordinary efforts are made to identify true vaccine injuries and to prevent them. Vaccine efficacy, however, is not only the result of direct protection from receiving the vaccine, but the protection afforded when a sufficient percentage of people are vaccinated, and that's 95% for measles, to prevent the disease from spreading throughout the community, known as community immunity or herd immunity. And that is why every state in the United States, including California, has passed laws requiring vaccination for school entry to protect our children and our community. However, recent events, such as the measles outbreak that began in Disneyland last December, has proved that our community immunity is waning to dangerously low levels due to over a decade of increasing use of the personal belief exemption in too many schools. For example, in 2008, an unvaccinated child was infected with measles in Switzerland and brought it back to San Diego, where measles spread to 11 other unvaccinated children. However, this disease did not spread further because there were sufficient vaccinated people in the immediate community to prevent further spread. However, recent events in California have shown that we are losing this protection as the number and sizes of places with significant numbers of unvaccinated people in the state has grown each year. The pertussis outbreak in 2010 infected over 9,000 people, hospitalized 809, and killed 10 infants. And the Disneyland measles outbreak infected 134 Californians, including 15 infants too young to be immunized, hospitalized at least 20 people, and both have been linked to communities with low vaccination rates and high use of their personal belief exemptions. This is the proof of why SB 277 is needed to protect the public from vaccine-preventable contagions. SB 277 is also needed to protect our most vulnerable citizens. Vaccine-preventable infections are particularly dangerous to people with cancer, transplants, and other immune disorders. These people often cannot be vaccinated for their own protection, and they depend on community immunity to prevent a contagion from reaching them. A mother of a child with a heart transplant shared that her child was sent home from school for weeks because an unvaccinated child with a personal belief exemption was exposed to chickenpox. She asked, why is my child's school made unsafe because of a decision of another parent? What about my child's right to an education? And what of this mother's need to earn a living to support her child and family? Both protection of the public and children from death and disability due to preventable communicable diseases and assuring children with special needs their right to an education are compelling interests to require all students be vaccinated unless granted a medical exemption. Now, unfortunately, the bill's opponents continue to make many misleading and false statements about SB 277 and vaccination, several of which have already been refuted in previous hearings. Opponents repeat fraudulent and retracted studies that autism is the vaccine injury, and that childhood vaccines contain mercury that causes autism. Opponents have made statements comparing vaccination to forced labor and rape, and falsely insinuate that children would be forcibly vaccinated and non-vaccinating parents would be thrown into prison. Opponents have wrongly claimed that the bill takes away informed consent, denies children their education or is unconstitutional. Now, we have worked with this committee to ensure that SB 277 protects our most vulnerable citizens, ensures that every child has an opportunity to receive an education, and protect our constituents from deadly, contagious, and preventable diseases. And sergeants, if you can hand out the material. Okay, thank you. This is why this bill is not only being supported by health groups, a long list of health groups that are knowledgeable about vaccines and diseases that they prevent, including physicians, nurses, pharmacists, optometrists, public health officers, hospitals, and many others. SB 277 is also supported by education leaders and organizations, as we have listed in the handout that's being distributed, including the State Parent and Teacher Association, teachers, school boards, principals and superintendents, school employees, school nurses, the State Superintendent of Public Instruction, and numerous school districts and school board members, because they know this bill is good for schools and students. And many others support SB 277, including child advocacy groups, businesses and unions, local governments, and newspapers across the state. A PPIC poll last week reported 2/3 of Californians say children should not be allowed to attend public school unless they're vaccinated. This majority will not be silent when more people are hospitalized or die of preventable contagious diseases. They will hold us accountable for denying the science of vaccination if we refuse to act. During the measles outbreak earlier this year, Californians saw signs in stores and restaurants warning them that if their family shopped at this business, they may have been exposed to measles. They watched local news reports on TV that people riding public transit may have been exposed to measles. They received notes from their children's school that their child might have been exposed to measles at school. And they worry about the health and safety of their infants who are too young to be vaccinated, their children, and their loved ones. California in the past has seen signs and notices warning of contagions. But with the protection of vaccination, they have not been seen for decades, until now. We do not want those notices to return, and we certainly do not want preventable contagions to return. The facts are clear. Now is the time to act. Vote yes on SB 277 to keep Californians safe and free from preventable diseases. Now I'd like to have my joint author, Senator Ben Allen.